Hello and welcome, friends. I am Dr. Malia Jones. I'm a social infectious disease epidemiologist, a nerd, and the editor-in-chief here at Dear Pandemic. And I am delighted to be joined this morning by Dr. Ashley Ritter. Ashley's a contributor here at Dear Pandemic. She's also a PhD-trained nurse practitioner and geriatrician. How are you, Ashley?
I'm great. Thrilled to be here this morning. How are you, Malia?
Doing okay. The weather is horrible in Wisconsin. It's -12 and snowing hard. So
Philadelphia is on our every other day of snow schedule, and so I'm okay with it for now.
Okay. I want to give a huge thank you to Bridges for the Deaf and Hard of Hearing for providing live closed captioning, which I have just recognized is not working because I haven't turned on the closed captions. I will work on that as soon as I'm done with this. Thank you. Bridges is providing live closed captioning and ASL interpretation, and we're so delighted to offer this service and improve access for people who are deaf and hard of hearing. So if you're using those services, please let me know in the comments. We are keeping track of that to see how many people we're reaching. So Ashley, you want to tell everybody about the newsletter while I fix the closed captions?
I'd love to. So Dear Pandemic has a newsletter. You can sign up for our newsletter to receive a quick digest of our best posts and most popular posts of the week. That comes about 2 times a week, and you can sign up in the top right corner of our website. I also want to remind everybody that we do not take questions cold. So if you have a question, you can also submit these in the question box on our website, which can be found at www.dearpandemic.org/. And while you're there, take a look at our posts. All of our posts are filed there, so you can look at questions that we may have answered in the past.
Terrific. So, hey, Ashley, I have a question for you. Should we be wearing nylon pantyhose on our faces?
Well, it may not be the fashion statement that you planned for 2021, but wearing pantyhose will create a better seal on your mask. It does this by keeping the sides of your mask closed in at the bridge of the nose as well, and it can improve the function of your mask. So it's one more tool in your toolkit. I'd say don't knock it till you try it. I may try it out on my 2-year-old. His ears are not so great at holding masks on.
It is tough on those little kids. Their ears are so soft.
Just not quite formed enough.
All right, so we have a question from we're going to take questions from our readers today, and I get to ask you the first question, Ashley. So we got a question from Nigel from Chilton Polden in Bridgewater in the United Kingdom. And here's his question. He says, I shared your Facebook post about the long-term effects of the vaccine and specifically the unlikelihood of long-term effects, and got this comment. Average development time for an effective vaccine is 17 to 20 years. The so-called COVID vaccines developed in a few months. What's wrong with this picture? And Nigel wants to know, what would your answer be to this?
Well, this is a great question. Thanks, Nigel, for asking it. And I would back this up with some facts. So while it looks right now that the vaccine was made just a few months ago, this research has actually been going on for decades, but it wasn't in the mainstream media. This research started decades ago on a few pieces of the coronavirus. The first being the use of mRNA to work with our immune system to trigger responses. The second is that this is not the first coronavirus that we've worked to make a vaccine for. Prior to COVID-19, we had SARS and MERS. And while we were looking at those viruses, we were looking at the spike protein. And so we had that sort of head start. And the third head start that we had is that we had tried to make vaccines for coronaviruses in the past, but there wasn't a need to have a vaccine for those because the outbreaks were contained before the need for a wide-scale vaccine was necessary. So this research started roughly 3 decades ago, and this was not, we had a tremendous head start, which I'm very thankful for. The second is that you don't need live virus to manufacture mRNA vaccines, which also gives us a bit of a head start when compared to a live virus vaccine, which you do need to produce the inactivated virus to manufacture the vaccination. And third, we had such high levels of COVID circulating in our communities that testing the vaccine, where you need to see if people in the community develop disease when exposed, sort of was easy to test because there was so much COVID circulating. And so the quickness of testing those vaccinations was aided by the urgency of the situation and how many people had COVID. And when you have urgency around the need for a vaccine, you also tend to have political will and money that follow. And so there was concerted effort to put the money and the science in place to make this happen. But this was built on 3 decades of previous research. And there was a similar situation. If you think about the swine flu, we had vaccinations for flu that existed. We were able to come up with a vaccine for the swine, that was H1N1, I believe.
Yeah.
In 2009, and we could use the research that we had and the sort of delivery systems we had to insert that particular virus.
Yeah, and then the one thing I would just add to that is you mentioned having money and political will. Part of the process here was the Operation Warp Speed, and what that meant for the vaccine manufacturers is that they were able to start production of the vaccine before they even knew if they worked, so that reduced the timeline from the clinical trials end to actually distributing the vaccine by quite a bit compared to what we would typically see.
Absolutely. So that would be my response. It looks quick in the popular media, but this was multiple decades and some luck in the way we were able to test this so quickly because it was such an urgent issue.
Yeah.
So this next question's for you, Malia. And this question is from Seda from State College, Pennsylvania. And the question is, we hear all these calculations about herd immunity, but if it turns out the vaccinated people are silent spreaders, as one of your posts mentions, wouldn't that mean we can never reach herd immunity? If so, shouldn't every discussion on herd immunity mention this critical factor? And if, say, 30% of vaccinated people can spread, does that mean herd immunity can never be achieved?
Yeah, CETA is a very astute observer. The efficacy of the vaccines, and specifically their ability to prevent transmission, has everything to do with what that herd immunity threshold is and whether we can achieve it. So I just want to backtrack a little bit and give a little refresher on what herd immunity is. Broadly, it's this idea that if enough people are immune to an infection, then one person who happens to be infected is very unlikely to come into any contact with someone that they could possibly give it to. And then the disease can't find a new host and it's not passed on through the community. So this prevents an outbreak from happening. I want to note that herd immunity is not the same as individual level protection. So we have to think about protection from what, and being vaccinated personally provides me with infection from disease, but having many people vaccinated in the population prevents an outbreak, protecting all of us from possible exposure, right? So how many people need to be immune in order to achieve this threshold? Well, there's a crude way to figure that out, and then there's the more exact way. And the crude way of figuring it out suggests 70% of the population needs to be immune for there to be herd immunity for COVID-19. But the reason that the numbers, when we say 70%, we usually say about 70%, or most scientists think it's 70%. I've also seen dissenters complain that the goalpost changed, that Fauci changed his point of view from 70% to 90%. Well, that's because it turns out it's quite hard to know exactly what the herd immunity threshold is if you don't have all the specific pieces of information about the disease and the way we're becoming immune to it. So, and as you know, as Sita points out, we're missing some of the relevant information here. We don't know yet whether or not the vaccines protect us from severe disease or actually prevent us from becoming infected. That second thing is what we would call neutralizing immunity or sterilizing immunity. There's some hints that the vaccines do in most cases, or at least in some cases, prevent infection, but it's not clear how often that happens yet. So, as Sita suggests, if the vaccines don't provide lasting neutralizing immunity, then yeah, it would be very hard or impossible for us to reach herd immunity. And we might have a situation where COVID-19 is endemic. But the good news here is that the vaccines are very good at preventing severe disease. And so we can still get to a point where COVID-19 becomes kind of, I'm not going to say no big deal, but much less of a big deal than it is now, even if it turns out that the vaccines don't prevent transmission. So what is, there's a good example for what this looks like. Actually, that's what we have for the flu. The vaccine for the flu is quite good at preventing people from dying of flu, but it's not that good at preventing flu infections. So we have flu outbreaks every year. They're a real problem. It's an ongoing challenge to manage flu outbreaks, but it is not a pandemic, right? So I think that at some point, even if the vaccines don't prevent onward transmission, they are still the way forward out of the kind of the global health crisis that we're in now. And we could still achieve a situation where we had outbreaks of COVID-19 or endemic COVID-19, and that was a more manageable situation because we have vaccines that prevent people from getting really sick. I'm going to drop a link in the comments, and this is a link to a game that I created actually called Zombie Unicorn Outbreak. It's designed for younger people, and although adults can love zombies and unicorns too. And I really designed this game to help people try to understand what herd immunity is, because it's a pretty complex concept that is just hard to wrap your head around. And so in this game, you can either be on the zombie side or on the unicorn side, and you can decide if your goal is to get all of the unicorns sick or to keep the unicorns safe, and then play around with how pretend disease spreads in a population of unicorns. So have fun with that.
That's awesome. Thank you so much for making things like this, Malia. I'm impressed by your skills every single day.
Well, I should say I did not actually code the game. My wonderful colleague at the UW-Madison Applied Population Lab, Caitlin Forpo, coded it and made it happen. I just had the idea for it. And
that's awesome.
It. Yeah.
So awesome.
So I've got the next question for you, but first I want to remind all of our viewers that if you have a question, they should go into the question box on our website at dearpandemic.org. We don't take questions live out of the comment box because we very often have to look things up, and we want to make sure that we're doing our homework and giving you the right information. So go put your questions over there. We read them all, and I read them all last week. I can tell you they are 90% about vaccines, and then we use those to plan what we're going to post about the next week. So I get to ask you a question. This comes from Kathleen from Washington. And Kathleen would like us to please revisit where we're at with kids and getting them out and about socially with their peers. What measures should we take, particularly when other children do not mask and distance with their parents? Do we need to have vaccinated parents? What metrics do we need to consider? And she adds that cases in her community are still substantial, but parents of young children are not that concerned. She says, my kids are not at in-person school, and my youngest seems to have some apprehension of people after 11 months of living lockdown style. So how do we ease his fear and also follow precautions?
This is a great question. And in addition to my scientific brain, I'm a mom of 3, and I know how challenging it can be to navigate, the world with COVID. And so what I would say is that we want to first think about the want to do and the need to do. And so I always think about what things need to happen to protect the mental health of my children, their learning, and their development. And I sort of put extra points on those need to do's. The want to do's hurt a little more, I would say, wanting to do other things. But if I can build a good need to do in a safe way, everybody can sort of get through till as we wait for warmer weather in many parts of the world, and transmission rates to come down, where we will have a bit more normal. And the second is, finding people who have similar views on how to socialize in the community, and you're not going to find everyone that's going to agree with you, and it's a lot harder to fight with those individuals than it is to make a circle that works for you, that provides you with those things that really are important for you as a parent, but also for your children, with socialization and an outlet, and education, and going to work. So these are some really fundamental things that we have to have in place. And so find a crew that just one to sort of join your pod, and to help get through this really difficult time. And the third is, there's not going to be a vaccine for children for a bit of time. And that puts us in a situation where, we have to think of what the right now is going to look like. And that's where we fall back to our SMART protocols, ensuring that we maintain space, that we are wearing masks consistently, and a mask that fits and feels good, and that we make that a habit. That we are going outside as much as possible when we're socializing, that we are restricting the people that we're around, and that we're keeping our visits short, so that we maybe get to see that best friend that isn't following the same rules, but we're doing it in a really quick visit with a mask outdoors and saying hello. And so those SMART and the last and certainly not least, adding to what Malia was saying about herd immunity, everybody that can get a vaccine should. The more adults that we get vaccinated, the harder it will be for this virus to circulate in the community, and therefore it will be easier for our children to go about a bit more of a normal routine. And so really embracing those SMART protocols, figuring out for your family, and really this varies for the age of your child, this varies for what the need to and have to do's are for your family, figuring that out and finding something that works for the short term as the transmission of the virus decreases is the way forward. But I hear you, and this is not easy, and taking it one day at a time, and really reflecting on what it is that you, your children, and your unit need to move forward is incredibly important.
Yeah, and I'll just offer a hat tip to one of our partner sites. Project Village is on Facebook, and we're going to put in a link to their website too. We had the founder of Project Village, Orrin Ross, on the show last week, and you can go rewatch that video on our website. She and our contributors, Christine Whelan and Aparna Kumar, talked. The whole show was actually about kids and mental health and how families are getting through. And they had some terrific ideas for socializing with kids, and helping kids in terms of their mental health and these fears that they may have developed over the last 11 months, really get through and get past those ideas. So we put a link to that here in the comments as well. One thing I'll just tell you what we're doing to get my older son, who is 10, some social time, is he FaceTimes with his friends while they are playing together on a Minecraft private server called a Realm. And I don't know what we would be doing without this hack. I mean, he's like basically playing with them in a world that is virtual. It's really awesome. So
that's fantastic.
Yeah.
It has been really important. My children are younger. They're 2, 5, and 7, and routine has been really important. And so we've had to really pay attention to, when they wake up and when they go to bed, that they're eating 3 times a day, and that they're running and doing something physical, or nobody sleeps, and it really perpetuates the cycle. So that's been sort of the thing that really matters to keep our kids feeling good and being able to engage, in multiple things. So I think it's different for every family.
I think so too. Yeah. And I mean, we're hearing a lot about mental health crisis among adolescent age kids right now. And I think that has everything to do with, we're just exhausted by this at this point. We're social creatures, teenagers perhaps especially, and we miss having social interactions. It's necessary.
Absolutely.
And on top of that, it's the middle of winter. And I think that's getting to me for sure.
We all have to remind ourselves that February is hard in like the best of year.
February, yeah, exactly. February is always my worst month.
Absolutely, absolutely. So every day we get through, we are getting closer to spring.
Yeah.
So I have a question for you, Malia. This is from Lena from Columbus, Ohio. And the question is, you've talked about vaccines. My mom asked a great question about them. Since we are still masking, what are the benefits? Also, what is the long-term outlook now due to vaccines?
Yeah, so I'm really glad you asked this question, Lena, because it's I do think it's a real challenge to communicate this message that even though we're vaccinated, a lot of the annoying nonsense of the pandemic is still the same. We still need people to wear masks and we still need to social distance, and life is very disruptive. But the benefits of vaccines are actually tremendously bigger than just being able to take your mask off. And I'd say mainly the benefit of being vaccinated is that it improves your chances of surviving a COVID-19 infection. So if your mother is 76 years old, I have no idea how old Lena's mother is, but my mother-in-law is 76 years old. Her chances of dying if she were to get COVID-19 are 1 in 10. And that's even with hospitalization and being on a ventilator and all of the best treatments that we have to offer. If she were fully vaccinated, for example, with one of the 2 mRNA vaccines that are available in the United States now, the estimated risk of dying, even if you did get COVID after vaccination, is 100 times less. It's 1 in 1,000. So that's a big difference. That's the main benefit of vaccination, is that it provides right now, it provides individual level tremendously good protection from dying. It also improves your chances of not ending up in the hospital in a medically induced coma on a ventilator. It improves your chances of avoiding lung scarring or other permanent organ damage if you were to get severe COVID. And we don't actually know yet, but it may reduce your chances of experiencing long COVID or some of these other more mysterious syndromes associated with COVID. That seems possible because it does reduce viral load and infection rates overall. So we are hopeful that it also reduces your chances of having some of the negative side effects of even a mild case of COVID. I'll also say that, even though for now we still need to wear masks and social distance, as we reach those herd immunity, getting closer to herd immunity, getting the population covered with vaccines will eventually allow us to return society to normal. It just doesn't happen instantaneously when one person gets vaccinated. So you do still have to wear the mask for now, and I realize that that is not good news, but eventually, looking at the big picture, as cases drop more and more, and we get more of those high-risk people covered with the vaccine, we will be able to stop wearing masks and return to, something that looks a lot more like normal life. I only didn't say normal life because it's hard to imagine like normal life right now, but
Yeah.
we'll get there. So, and then when I was trying to think through what are the benefits of vaccines, I think also peace of mind. I mean, I would feel so much better, and I will feel so much better when my mother-in-law has had 2 doses of the vaccine. She's got her first one scheduled about 10 days from now, and I'm super excited because I'll just be able to stop worrying about it. So I will feel better, and I think there are mental health benefits to being able to quit worrying.
Yeah.
So yes, you do have to wear a mask for now, but there are definitely benefits of vaccination.
I sort of look at it as, my husband is not vaccinated and I am fully vaccinated. And when I go out, the mask is an extra layer of protection, but I know that if I were to get COVID, I'm probably not going to die of it. Whereas if my husband goes to the grocery store, the thing protecting him most is his mask. It's like the high level of protection. And so masks will continue to be part of what we're doing. But the mask is really like the last line of support right now, and we to have a little bit extra of layering of support with a vaccine is a huge relief. We're then asking the mask to do a little less of the work.
Yeah. So part of this question from Lena was also the long-term outlook, and I want to take a look at what has happened in a specific example, Israel, because it gives us a really good picture of what this long-term outlook might be. Israel has managed to administer at least one dose of a vaccine to 70% of its eligible population. So the population of people who are at least 16 years old. They started with the highest age groups too. So they have quite good coverage in those high risk groups. The vaccine campaign in Israel started just as the new UK variant was beginning to hit there. And the country was, if you look at the data, they were just at that pivot point of starting to see exponential spread. And the cases in Israel did continue to go up substantially for a couple of weeks after that. And then kaboom, we're now seeing them plummet, especially in the oldest age groups, which is amazing news. Now, we don't really know if that was because of the vaccine or not. It might have happened anyway. In fact, cases are plummeting here in the US as well, and we don't have anywhere near that kind of vaccine coverage. But there's some other great news from Israel that I think is really key to focus on here. So they have 523,000 fully vaccinated Israelis with the Pfizer vaccine specifically. And among those 523,000 people, there were only 544 cases of COVID. 4 of them were severe, and there were 0 deaths among fully vaccinated people. So this really does confirm the clinical trials efficacy rates for preventing severe disease and especially death. It's really awesome news. There was the Prime Minister of Israel did a press conference in which he said that 97% of the recent COVID deaths in Israel were among unvaccinated people. And so, I mean, in short, these vaccines have just knocked it out of the park. I mean, they really work. And I think that means our long-term prospects, after we get a lot of people covered with them, are very good. We'll have we may still have a COVID-19 epidemic. We might have outbreaks, but the acute, crisis where people are dying by the thousands every day and filling up hospital wards will end. And that's really what we're looking forward to. And that's what's happening in Israel right now. So it's very hopeful to look at what's happening there. And we're linking to our World in data that shows the vaccination rates by country. So you can take a look at the coverage in Israel and elsewhere.
Yeah, it's so nice to see sort of the light.
It is. Yeah, it really is. And I think in the next couple of weeks here, we're going to be seeing a couple more of the vaccines go to the FDA for emergency use authorization. It really looks that way. And I am very excited to hear the full versions of the data on the Johnson & Johnson vaccine and also the AstraZeneca vaccine, which I'm hoping are both going to come online very soon here.
Yeah, stay tuned. As soon as we hear, we will let you all know.
Yeah, as always. All right, well, we're out of time already. That went really fast. We get a ton of questions and we can't get to them all in our live shows, but we do, as I said earlier, we read each and every one of those questions and we really use them to decide what we're going to post on for the upcoming week. We use them for next week's live show. And so if you have a question, please go to our website, dearpandemic.org, and submit it in the question box. We've also answered a lot of questions already. And so I really recommend you just, put in our search box some keyword from your question and you'll probably find something about it. I looked at how many posts we've written. It's been almost a year that we've been doing this, Ashley, and we have written 850 posts about practical advice for living in a pandemic.
It's really unbelievable.
It is really unbelievable. And before we close, I just want to offer another thank you to Bridges for the Deaf and Hard of Hearing for providing ASL interpretation and CART services so we can offer equal access to people who are deaf and hard of hearing. If you have used those services, please say so in the comment box so that we know that you like them. And that's all we have time for. So thanks for joining us. We'll be here at the same time next week, Saturday at 9:30 Central Time. And next week, I'm going to be joined by Dr. Sandra Albrecht, who is the Dear Pandemic contributor. I think it'll be her first time on the live show.
It'll be great, I'm sure.
It will be.
Definitely don't miss that.
Until then, stay safe and stay sane.